Dr. Latham, thank you very much for discussing today the HPV vaccine. There's a new article in Pediatrics. Can you tell us a little bit about the findings in this new article?
Yes, I mean the article's great. The vaccine was approved for use in 2009 or recommended for use in 2009 in girls, and then in 2011 for boys. So they've been studying that every year, and they found that after 6 years, there's actually a 64% reduction in the HPV. However, only 38% of people have even gotten the vaccine.
Right, right. Well, we both struggle with that. The best time to give this vaccine is when girls and boys come in for their 12-year visit because they're getting all these other vaccines. And so it's an anti-cancer vaccine, and that is a really good time to give it. What do you find to be the most challenging thing in getting these children vaccinated?
Well, I think they're getting a couple other vaccines at the same age, and they're a little hesitant to get more shots. But there's a couple reasons we give it at that age. One, that's when they're coming in for their other shots anyway, and we kind of lose them to follow-up sometimes after that. So it's important because that's when they're getting other vaccines. But also, the teenagers are very immunoresponsive. So if we give a teenager the vaccine, they're going to have a greater response to it than someone is who's 20. So it's easier time and better time to get it when they're in their teenage years or at their 12-year-old visit.
Definitely. The other thing is sometimes people say, well, maybe this is just a temporary infection, so why do I need a vaccine against it? But remember, when you get that HPV infection, the virus actually mutates those cells and can lead to cancer. So we want to prevent that vaccine or prevent that infection with the vaccine and prevent those mutations that lead to cancer. So very important.
Yeah, and it is true. Because teenagers are immunoresponsive, a lot of them will go ahead and clear the vaccine themselves. But some of them don't, and some of them go on to develop cervical cancer or anal cancer or genital warts, and those are pretty nasty things to have happen. Yeah. 12,000 people, 12,000 women a year develop cervical cancer, and 4,000 of them die. Right. So if we can prevent that, that's tremendous.
Absolutely. Well, thanks very much, Dr. Latham. I appreciate it. Thank you very much.